Are generic and brand name eye drops the same? If you're interested in finding out, keep watching. Hello everyone, I am Dr. Rupa Wong, board certified ophthalmologist, and on this channel we talk about eye health, eye surgery, and a little bit about my life here in Hawaii. So if any of that interests you, please make sure to like, follow along, subscribe, do all the things so you can get these videos as soon as I make them. All right, if you stumbled upon this video, it's likely because your eye doctor switched you to a generic eye drop, or your insurance, more than likely, switched you to a generic versus a brand name eye drop. So are the two the same? Well, first, the biggest reason that insurance companies want to switch you, and you probably want to get on a generic, is because of cost. Generic eye drops usually are 80% less than the brand name. And if you switch, especially a glaucoma patient who has to take eye drops every single day, to generic from brand, you can save up to $1,300 a year, which is a lot of money. Now, as patents developed by these pharmaceutical companies start to expire, then these other companies swoop in and they make generic versions of the eye drop. The first of this to occur was with Xalatan. That patent expired back in 2011, and then since then, we have had a lot of generic versions of latanoprost, which is the active ingredient in Xalatan. So are these drops the same? Well, for most patients, it's fine to switch to a generic eye drop, and it functions the exact same manner. Now, the results from clinical studies, they're mixed as to whether generic eye drops get absorbed in the same way that brand name eye drops, or if they're as efficacious. Now, if you take generic medications orally, like ibuprofen versus Motrin, or warfarin instead of Coumadin, the FDA, if you live here in the US, has slightly different rules for generic medicines that you take versus generic eye drops. Now, for generic medications you take, you have to prove that it's the same, that it's going to give you the same result as the brand name. For generic eye drops, you don't have to prove the same thing. You just have to have the same active ingredient. You don't have to show that the generic eye drop is the equivalent and can cause the same types of good effects, like whether lowering your eye pressure or targeting the bacteria. You don't have to show that it's equivalent the way you have to with medications. So there are a lot of inactive parts of eye drops, more than just the active ingredients. And all that a brand name will tell you, they'll have the list of all of the ingredients, but it doesn't say the percentage. So when generic manufacturers are making their generic drops, they might be using either different inactive ingredients or in different percentages. So it can sometimes create a different effect. What are these inactive ingredients? These are things like preservatives, pH adjusters, antioxidants, thickening agents, buffers, and substances to adjust tonicities. And so what this can mean is that these can make a difference between the eye drop spreading out and getting absorbed really well into your eye versus clumping up in the bottle versus, if it's really hot, getting affected by the heat or the UV light. There's a lot of things that go into manufacturing an eye drop. Some generic eye drops cause more eye redness, some sting more. And the reason for that is because of these inactive ingredients, these other things that are in the drop. The active ingredient might be the same, but you might notice that different. So oftentimes we'll say it's the vehicle or the carrier, and that's like all the other stuff that's delivering the active ingredient to your eye. Take, for example, Xalatan, the first new prostaglandin brand name eye drop that was out on the market, back in the early 2000s. So all of the vehicles and carriers can be different. For example, in one bottle I was reading, there's potassium chloride, calcium chloride dehydrate, sodium chloride, benzalkonium chloride or BAK, which is a preservative, glycerin, which is a preservative emollient, sodium borate, decahydrate, boric acid, sodium hydroxide, hydrochloric acid, water for injection. So a lot of other stuff in these drops. Now, in the case of Xalatan, the first brand name one that the patent expired, 99.995% of what's in that bottle is actually all the other stuff. It's not the active ingredient. So because generic manufacturers don't have the exact recipe, the generic eye drop is different than the brand name. This can mainly affect the pH balance of the drop. So you guys remember pH, acids 1 to 7, bases 8 to 14, but it's really, really important in the creation of drops. The pH of your blood in your tears is at 7.4. Now, some drops are formulated just a little bit more acidic than that, 7.0, so that they can penetrate the cornea a little bit better and get absorbed by your eye better. Because if it's just neutral, just like the tears, it might not get into the eye in the same way. Now, all of these other ingredients, these inactive ingredients, they affect the pH of the drop, and they can affect them in big ways. So it can be much more acidic than the brand name or much more basic than the brand name, and that can affect how you tolerate the eye drop. If it stings a lot, it can affect the redness, and it can affect how much gets absorbed. Take a look at this table of the different versions of Zalatan. Look at the difference in pH in so many of the different manufacturers. They aren't the same. That clearly is going to affect the absorption and the way that you tolerate the eye drop. Generics also have different packaging. The bottle is different. They only need the active ingredient to be the same. So if you were on a brand name eye drop and you switch to a generic, you might notice that it's easier or harder to get the eye drop in with the generic bottle, and the size of the eye drop might also be different. And that's a big deal. If the eye drop is larger, then you might run out faster of your medication, and the doctor might need to call in refills for you faster. Now, all of that being said, the majority of the time, it is fine to use a generic eye drop versus a brand name. And for most of the patients, it works in the same way. However, for a small number, keeping the brand name eye drop may be a benefit. And there have been reported cases when a brand name eye drop was switched for a glaucoma patient to a generic, then their pressure of their eye went up 10 points, and high pressure is not good. You don't want the pressure to go up. That's a bad thing. And then when they switched them back to the brand name eye drop, the pressure went back down. So these kinds of things can happen. But if your pressure is well controlled on a generic, if your inflammation is well controlled on a generic, if you're able to cure that bacterial conjunctivitis with a generic, then you are good. But your doctor may switch you in reverse. If you're on a generic and things aren't quite what your doctor wants, they may switch you to a brand name eye drop for all those reasons I just discussed. All right, guys, I hope that was helpful in figuring out the difference between brand versus generic eye drops. For most people, generic is fine and you can save a ton of money, but for some people, they may actually need the brand name eye drop. Drop them down in the comments below if you've had any issues with generic or certain brands of eye drops. I'd love to hear from you. And if you have any comments about different topics you'd like for me to address, drop that in the comments below as well. Until next time, I'm Dr. Rupa. It's good to see you. Bye-bye.